Hello, today we are going to talk about biliary ascariasis in pregnancy. So, as an introduction, the radiation exposure should be as low as reasonably achievable for everyone. So, for pregnant women, is no different. Obviously, that we should have extra care because it is teratogenic, mainly in the first trimester. But the pregnant women is no more sensible than other people to radiation.
Ascariasis, as is written here, is an infection caused by a worm called Ascariasis lumbricoides. The natural habitat of this worm is in the jejunum. However, it can invade the biliary tract, leading to biliary ascariasis, which is our specific topic. Regarding epidemiology, ascariasis in general is the most common helminthic infection seen in the world. As children are more likely to play with contaminated soil, they are at higher risk, and the highest intensity occurs in children aged between 5 and 15 years old who have simultaneous infections. Prevalence is higher in tropical and developing countries, and regarding adults, women are at higher risk, especially those living in rural areas. Biliary ascariasis specifically is more common in adults due to the migration of adult worms provoked by other diseases.
Now, as for the causes, it's the consumption of contaminated food, water with a worm, and that is usually through the contact with contaminated soil, and it's more common in children as mentioned. The mode of transmission is fecal-oral, and certain risk factors include living in tropical areas with a warm climate, poor sanitation and hygiene, use of human feces as fertilizer, and pregnancy because of the increase of estrogen and progesterone that influence the diameter of the sphincter of body.
Okay, so regarding the pathophysiology, basically the life cycle of Ascaris lumbricoid starts when the host ingests the eggs. The larva is then released after hatching and it invades the intestinal walls. Then, via portal circulation, it will reach the lungs. It can get to the alveoli, trachea, and larynx, where it kind of maturates. Then the larva is expatriated into the mouth and swallowed back into the intestine, where it develops into adult worms, which then lay new eggs. The female worm can produce around 200,000 eggs per day, which are very easy to find in the stool. So it divides in two main phases, the pulmonary, where it can cause pneumonitis, and the intestinal phase that can cause mechanical obstruction. Regarding the biliary ascariasis specifically, it has a natural inclination to migrate and seek small orifices. So this is what the pathophysiology stands on. The heavy worm are prone to reach the duodenum and from the jejunum, and from that it can go either it can enter the ampulla and either go to stay in the ampulla, common bile duct, or hepatic ducts, or anywhere else in the biliary tree, and can cause biliary colic and sometimes obstructive jaundice.
Now, most infected individuals have a low burden and are asymptomatic, but however, they can travel to the lungs or in the GI tract, and they can produce certain symptoms, which may include non-productive cough and burning sternal discomfort, wheezing, dyspnea, hemoptysis, and fever. And if they travel to the biliary tree, they can produce a biliary colic, abdominal discomfort and distension, jaundice, and sometimes symptoms of cholangitis and cholecystitis.
Okay, now regarding diagnosis. Among the imaging modalities available for the diagnosis of this disease, the ultrasonography is the modality of choice because it's sensitive, specific, safe, and non-invasive. The transabdominal ultrasound is a reliable modality both for the diagnosis and also for the post-therapeutic surveillance of this disease. It can be used for acute ill patients and also for pregnant women, which is our case. Although it is not the gold standard imaging modality, it is most used because also the disease is most prevalent in low-income countries where the imaging modalities are not, other imaging modalities are not available. Regarding some of the ultrasound findings for this disease, the worms can be seen normally in the biliary duct and manifest as echogenic non-shadowing tubular structures from 3 to 6 millimeters. And have a hypoechoic center and more echogenic walls. The worms typically are parallel to the long axis of the bile duct, or sometimes they can be coiled up. We will see in further images these characteristics. Okay, so these first images shows a longitudinal ultrasound section of a relatively distended gallbladder that contains a long echogenic and non-shadowing interluminal tubular structure with a central anechoic linear area. This is the so-called inner tube sign, which represents the digestive tract of the worm, which we can see here. Okay, next we have also a longitudinal section of the gallbladder and has a worm represented as an echogenic and non-shadowing tube-like structure, which is called the tube sign. In this image, we also have a longitudinal section, and here the gallbladder is relatively contracted and shows a non-shadowing structure with overlapped tube-like worms, which are here, and this is called the spaghetti sign. And although the worms in the gallbladder are less common, since they are more common in the ducts, they can appear with an appearance of an intraductal worm on a transverse view, which is useful to solve any doubt of diagnosis when seen on a longitudinal section. Next, we have a transverse scan, which shows the left hepatic lobe with a dilated intrahepatic duct, which is packed with the worms in a form of a bolus, which is seen here with the arrows. And these boluses are so-called the pseudotumors because they have this appearance, but with clinical features, age, and socioeconomic status of the patients, you can have a corrected diagnosis.
Okay, so regarding other imaging techniques, the role of CT in biliary ascariasis is generally limited to patients with liver or pancreatic involvement. MRI, including MRCP, has the advantage of providing three-dimensional maximum intensity projection images of the biliary tree without the risk of contrast, allergy, and evasiveness. Details of the extrahepatic biliary tract can also be obtained. Nonetheless, though an excellent modality, it is not cost-effective, especially in developing countries where the prevalence of ascariasis is high. ERCP plays a unique diagnostic as well as therapeutic role in biliary ascariasis. It is useful for direct visualization of worms at the papilla and also for radiographic demonstration of the worms in the biliary tract. Here in the left we can see a CT scan of the abdomen demonstrating features of acute pancreatitis with pseudocyst containing fragments of a dead worm. On the right we can see an ultrasonogram of the same patient confirming the CT findings and showing a fragment of a dead worm within the pseudocyst. Here in the ERCP image we can show multiple linear filling defects which are correspondent to the worms. And the round filling defect, which is a stone, at the lower end of a dilated common bile duct.
Finally, we bring a clinical case in which we have a 26-year-old pregnant woman that comes for the first prenatal checkup at 24 weeks of gestation. During pregnancy, there was nothing abnormal except for the anorexia and occasionally episodes of nausea and dyspepsia. And regarding the vitals, everything was normal, slightly hypertensive, but everything normal. About the physical examination, the pregnant woman is mildly jaundiced with a non-tender abdomen and non-palpable liver spleen. And regarding the laboratory tests, it has a mildly increased total and direct bilirubin, mildly elevated aminotransferases, elevated eosinophil counts, and a normal total serum bile acids. About the ultrasound performed, it reveals a curvilinear echogenicity of the worm within the gallbladder, as we can see here, and a normal or mildly dilation of the common bile duct. Regarding the liver ultrasound, it reveals a homogeneous texture with a little bit of fatty deposits, but there is no signs of ascites, and fetus it's normal. Regarding the treatment, the patient was treated in a conservative manner. these are references, and thank you for your attention.